Acute glomerulonephritis is a kidney disorder in which immune complexes are basically being deposited on the basement membrane of the kidney. Now, this is going to cause inflammation and it's going to cause decreased filtration of the kidney. Your afferent arteriole, normally blood's going to come into that afferent arteriole and be filtered through the kidney onto the collecting ducts. When you're going to have this buildup of all these immune complexes, that's basically going to prevent, and you're going to have inflammation as well. It's going to prevent a lot of the fluid from being able to be excreted. So because you can't excrete a lot of the fluid, you're going to have buildup of fluid inside of the body. You're going to have buildup of fluid in the tissues. And that's going to lead to edema, and at least mild to significant edema. And this normally occurs, this is usually, a lot of times this will happen in children, and this is after a strep infection. And this is differentiated from nephrotic syndrome. Nephrotic, that big O, you got a loss of proteins. So in nephrotic syndrome, it's actually the opposite. So these foot processes, especially foot processes in that glomerulus, which is going to prevent the excretion of proteins in the urine. And basically that those foot processes are going to be lost and you're going to be able to excrete protein. This is also going to cause some edema because normally you're going to have hydrostatic forces are going to keep the fluid within the blood vessel, but because you don't have those proteins, you're going to have edema as well. So both with the nephrotic, acute glomerulonephritis and nephrotic syndrome, you're going to have edema in both of those.